Hello, I'm Anthony Llewellyn, one of the psychiatrists here at the School of Medicine. Welcome to this clinical rotation in psychiatry for Year 5. On behalf of the rest of the faculty, the supervisors, the registrars, the residents, the multidisciplinary team, all those people that will be teaching you in this clinical rotation, we'd like to warmly welcome you to psychiatry. We think you'll have a very interesting, informative and fun experience and realise how important it is to consider the mental health and well-being of our patients, not just within mental health units and community mental health teams, but more broadly. So, this video is to give you some key messages to help you get started in relation to your rotation. Now, of course, in doing that, I need to remind you that it's always important to stay in contact with the official communication channels for the course, which of course are via Blackboard and your course, as well as official university email for important messages and updates and changes. Also, depending on which clinical site that you are at, you should check in with your clinical dean as to any specific information about your rotation. For the Hunter Clinical School students, there will be a supplementary video touching on a few specific details about the Hunter Clinical School experience. So what we're going to talk about in this video is the purpose of the mental health term, the general structure of the rotation, your learning opportunities and some resources to support you in your learning, the important process in terms of what we expect of you in the rotation and the assessment that occurs at the end of the semester, as well as if there is a requirement for some remediation, what that constitutes. Now, if you go and look at the course outline, you'll see there are a number of learning objectives or objectives in relation to mental health in Year 5. But if we were to condense the main objectives of the rotation psychiatry, it would be probably twofold. One is to prepare you to have the sort of knowledge and capabilities and understanding around mental health in order to deal with the most common psychiatric conditions that can occur in medicine, so that were you an intern in an emergency department next year, for example, or on a mental health unit, you would be reasonably familiar with those common conditions and be able to do some acute management, be knowledgeable about side effects, and speak with some authority to patients about the types of things that can help when someone has a mental health problem. Secondly, we do believe that psychiatry gives you a really good taste of what it's like to work in an interprofessional team. We basically invented multi-professional teams in mental health, and we've been doing it for a while. So you get a good chance to not just meet with other doctors, but value the experience of the nursing staff as well as the managers, and of course the allied health professionals, in particular psychologists, social workers and occupational therapists. So take advantage of that. It's an opportunity to understand other people's roles and what they can contribute, not just to mental health, but in general health as well. So the structure of the term is of course 7 weeks. Depending on where you are, that might be a continuous 7 weeks with some palliative care woven through, or in certain schools there is a week off to do your formal palliative care placement. And by the way, don't forget to start your palliative care spaced learning exercise, because if you don't start, you get caught up, and that can be a little bit of a problem in terms of completing the overall medicine and psychiatry and PHCS course. You of course have a logbook that gives you some instructions about the sort of things that you are required to do during the term, the types of experiences we want you to do, some of the workplace-based assessment tools. For example, there is the general requirement to be on service for 35 hours per week, but that does include scheduled teaching time as well as meetings like ward rounds and tribunals where relevant. We do encourage you to try and attend ward rounds and particular mental health tribunals when you can. In particular, we would encourage you to try and attend a tribunal if possible, so that it gives you a bit of an understanding of the interface between medicine and the law that you don't get in most other. There's also a requirement for an out of hours experience or after hours experience that will differ from site to site, but the importance of that is probably two things. One is medicine often happens a little bit differently outside the normal hours of a hospital with different resourcing levels. But secondly, for some of you who might be doing a certain rotation, it gives you a chance to top up by experiencing other types of patients, and particularly seeing patients when they are more acutely unwell. Of course, in your logbooks, we ask you to do a number of both mini CXs and CBDs. I'm going to break those down because you may not be completely familiar with what those concepts are. So a mini CX is a mini clinical examination. Basically, we want you to spend about 15 to 20 minutes talking to a patient in front of an assessor. It probably makes sense to agree up front the type of feedback that you're wanting to get around that assessment, and what we would generally recommend, particularly for the first one, is getting your assessor to focus on your ability to elicit, say, a mental state examination or examine the risk issues in a particular patient. If you do a few more, you might move on to deeper understanding of the past history of mental illness, or perhaps something around counselling like a discharge planning exercise. So you should be spending about 5 to 10 minutes at the end of that session, after you've thanked the patient for their time, getting some feedback from your assessor in the structured format. And that's really to help you understand where you sit in terms of your ability to interview patients and work with patients, because that's going to be critical when you're an intern next year. Secondly, we have the case-based discussions. Now, every assessor is going to be different. They're going to probably have a different preferred style and format for presenting cases. So the trick here is to actually have a chance to present to more than one or two people to experience that. Mostly we'll be looking for you to be able to bring along the information from a case and present it in a pithy and synthesised manner, as if you were handing over, say, an award round or discussing with the registrar. So it doesn't need to be a grand round style formal presentation extending for several minutes. It should be about 10 to 15 minutes, and then there should be some time for some questions and some feedback again. Again, this is going to be critical because we're hoping that through this exercise you develop the ability to gather the right information that you need for patients, and to then present that information to more senior colleagues in order to sort out what problems need to be sorted out for the people under your care. So a good approach to the case-based discussion is to think about what would be the problem list if you were an intern. What things do you need the input from the registrar or the consultant in relation to this particular case? Now, both with the mini CX and the case-based discussion, these are real-world examples. So you're free to actually go and talk to the patients beforehand, read through their files, talk to the team. Don't just set it up as if you haven't seen the person before. We want you to feel like you're doing this as a real intern who will generally have the opportunity to catch up with the patient first before, say, presenting them to a colleague. A few other things in the logbook. We strongly encourage you to do some ECT observation, and there are a few other things in there that we also recommend. The other thing that is important is obviously the APSAV form, the assessment of professional skills and behaviour. Again, this gives some feedback on your performance, but also sets the standard for what we expect of you as a final year student, which funnily enough is probably close to the standard of professionalism that we would expect of an intern. So you need to complete your logbook satisfactorily, along with getting a satisfactory APSAV form in order to complete the rotation. And that will then permit you to sit the end of semester examination. In terms of the types of changes we've made for 2019, probably the biggest thing is an increased emphasis on more workplace-based assessments, which is going to be the thing that we focus even in more heavily in the new Doctorate of Medicine. Now, a quick reminder, any time off requests are to go to the Year 5 manager first, and then get approved by the Year 5 Psychiatry coordinator. And in a lot of cases, if you're requesting time off, you will need to make that up at some other point during the semester. Now, assessment. I'm sure you've all been waiting for that. As you probably already know, the assessment consists of a 3-part OSCE examination. One component of that is conducted by the Interactional Skills Group, and they will give you some specific teaching around that and some information about how to succeed at that part of the OSCE. The other 2 stations are set through Psychiatry, and generally speaking, one of them will be more along the lines of a Viva case, where you are given a scenario and have to discuss a number of questions around it with the assessor, and the other one will be more of a simulated patient exercise, occasionally a simulated family member, where most of the emphasis is on the assessor observing your ability to interview and interact and answer questions from the sim actor perspective. So the stations last 15 minutes and you have 5 minutes reading time. So they take about an hour, all 3 of them. There are some practice stations available on the MedEd help site, which I will talk about shortly. The question you probably have is what happens, or what is the standard for this examination? So the standard is that you have to be satisfactory in at least 2 of the 3 stations. You can have a borderline or an unsatisfactory in one and still be deemed satisfactory. However, if you are borderline or unsatisfactory in more than one, then that does put you into the remediation group. We also provide feedback to anyone who has received a borderline or unsatisfactory on one of the stations of the exam. So please don't be surprised if you get an email that says, look, hey, you actually were satisfactory in this examination, but one of the stations, one of the assessors observed a few things. We'd just like to let you know what they were in case you feel that they are relevant to you. Now, the thing about OSCEs is you can have a bad station, and that might be your performance. It might actually just be something that the assessor missed. So you, as an adult, have to think about that feedback and think about whether it's helpful to you. I forgot to mention that the OSCEs are held in Newcastle in June and November, depending on which semester you are in. So, if you do end up requiring some remediation, basically the way that works is you'll need to spend about a week at the mental health centre at the Mater on one of the units here, which is where I am, and you will be given a mini logbook which requires you to complete a series of workplace-based assessments, mini CXs and case-based discussions. So you will be familiar with them already. So what we're doing is, even though the OSCE is a reasonably high standard exam, we're elevating it to an even higher standard, which is the workplace-based assessment. And we find, because you're doing that across the course of the week, you actually get the targeted feedback that you need. And so far all students have gotten the feedback they needed, so that by the end of the week they managed to demonstrate satisfactory performance in both the mini CX as well as the case-based discussion, and they are able to complete the rotation, and generally that means completing the course as well. The resources to help you, there are some resources listed on the Blackboard website. I also mentioned that we have a website called MedEd Help, which most of the students now know about, but I'll show you an example here of it. This is mirrored to be similar to the Blackboard course in that we give you a week-by-week breakdown of what we call the syllabus in the psychiatry rotation, the things that you should be thinking about, learning about and experiencing and doing week by week. We've broken that into 5 weeks, with a 6th week being a consolidation week, so that you cover all the key things that we expect in terms of topics in psychiatry. On the first post in MedEd Help, you'll see a post called How to Study Psychiatry, some recommendations. We've taken the time to curate a lot of great resources, including recommendations around things like free books as well as paid books, videos where you can practice the mental state examination, blog sites, podcasts, a whole bunch of things that can be helpful. If you ever have something that you think should be added to that, we'd love to hear about it, by the way. So check out that website, because I think it gives a good structured way of approaching the rotation. We've had good feedback from the students about how helpful it is to have that sort of support and structure. As I mentioned, there are a few key things on that site, one of which are 4 practice exams to help you practice for the OSCEs, as well as a helpful handy link to the College of Psychiatrists e-learning module on interviewing Aboriginal people with mental health concerns. We would like all of you to complete that e-learning module. It's a very informative, fresh module that will very much help you in understanding some of the issues around supporting people of Aboriginal background with mental health problems. But also, if you go through that module, you'll actually learn a lot about what it is in terms of best practice in terms of psychiatry, in terms of interviewing people in general as well. Other supports and resources, your team are there to help you. There's of course the university staff and the education registrars. I mentioned Blackboard, and you'll find some resources also on the RANZCP website. In terms of text, we recommend the following as a starting guide. It's a free text that's downloadable from the HEDI website, and it's called Acute Psychiatric Management. It's now in its 3rd version. This is a text that was initially put together for first-year trainees in psychiatry in New South Wales. And actually, if you go through the contents, you'll see that it covers pretty much all the topics that we expect of you in psychiatry, at least at a foundational level. You may and probably will need to do some extra reading post it, but it gives you a good snapshot, and it's quite an easily digestible guide. And because it's written from a New South Wales perspective, it covers New South Wales issues like things like the Mental Health Act. Okay, so there you go. That's some key messages for your psychiatry rotation. I hope you found this helpful. Please contact one of the faculty if you have any questions, and we do hope that you enjoy your rotation.